the trick with arthritis is it actually starts to develop much earlier than the people begin to notice symptoms. So if you keep that in mind and you understand the nature of arthritis, you could actually probably prevent a lot of problems for yourself in the future. So why does it hurt? So cartilage does not have any nerve fibers. Cartilage is aneural. That means even though the cartilage is damaged, we should never know that because the brain has no way of knowing that because there's no neural connection to cartilage. What happens is the cartilage breaks down and you crack that subchondral plate, the firm surface where the cartilage sits on it, and then that is what starts to hurt. Okay, so as long as you never get to that stage, you're probably not going to have a ton of pain with arthritis. This is probably why you feel symptoms later. Of course, there's a whole host of other problems, ligament stiffening, muscle weakness, and all of those play into pain, and we'll talk about that. But basically, the molecular basis of pain is that you have different inflammatory cytokines or proteins that the body releases when it senses damage or irritation. Tumor necrosis factor alpha, which is also very high on rheumatoid. Interleukin 6, interleukin 1. And you may have been seeing these in newspaper talking about virus and things like that because these are the same inflammatory mediators that are used to fight pathogens. Well, unfortunately, when you have an injury in the body or if the body believes there to be damage, it will send out the same group of soldiers or the same group of cytokines to get to that area and sort of fix it. But with arthritis, it ends up just causing more pain and more tissue damage. And then mast cells, which are a big type of, I guess you could think of it like a white cell, sort of releases these things into the area when there's a signal to the body that there's inflammation. So you have cartilage breakdown, subchondral plate fractures, signals to the body there's inflammation. All of these inflammatory mediators go out and they induce pain and induce further tissue damage.